In the area of smartphones and workaholics, sleep has become a luxury rather than a necessity. Sound sleep seems to be an alien concept nowadays. Almost everyone today is either suffering themselves or probably knows someone who struggles with sleep issues. Stay with me to know more about this rising epidemic. My name's Dr. Greg Celaya. Defined as prolonged and usually abnormal inability to get enough sleep, insomnia encompasses both the inability to fall asleep despite being tired, as well as the inability to stay asleep through the night. Insomnia can be either acute or chronic. Acute insomnia usually lasts for only a few nights and doesn't have long-lasting effects. In comparison, chronic insomnia usually lasts longer than 30 days. This can eventually affect your quality of life and can bring upon a whole host of other health issues. Depending upon your reference, there are 4 or 5 phases of sleep cycles. In a 5-phase model, phase 3, 4, and 5 are where you have an increase in growth hormone. This is where the body repairs or restores itself. One test I like to run is cortisol. It's an adrenal hormone that can keep you awake. Remember, when it goes up, melatonin goes down, which can keep you from sleeping. The test evaluates samples of salivary cortisol throughout the day so we get accurate measurements in how you're dealing with the daily stressors. When I run it for a patient that has sleep issues, I make sure we get additional samples to determine if adrenal issues play a role in your sleep problems. Insomnia can occur due to a multitude of different things. Let's first look at lifestyle. Drinking in excess of caffeinated beverages throughout the day or before bedtime. Ingesting heavy meals or alcohol before bedtime. Not exercising. Excessive napping during the day. And experiencing stress. Poor sleep hygiene can also affect your sleep. Your bedtime ritual is crucial to your ability to sleep peacefully. Not having a regular bedtime leads to no fixed sleep pattern and makes it difficult to fall asleep. Uncomfortable bedding can also lead to poor sleep. Using electronic devices is the most common problem with bright lights, from clocks, electronic devices, TVs, etc., and also excess noise. The use of electronic devices right before bedtime can emit blue light. The blue light can stimulate cortisol release by confusing our brains into thinking it's daytime. Pre-existing health conditions can also lead to insomnia. Common psychological issues are depression, grief, anger, and stress. Medical disorders include asthma, hyperthyroidism, chronic pain, and cancer. Medications can definitely disturb your sleep. The long list includes antidepressants, steroids, medications containing caffeine, diuretics, and many more. There can be a genetic basis for sleep disruption. A study published recently in Nature Genetics, which was comprised of more than 100,000 individuals, demonstrated the presence of 7 genes linked to insomnia. Treatment for insomnia can include lifestyle changes, cognitive behavior therapy, medications, and alternative therapies. Let's look at lifestyle modification. Try to sleep and wake up at the same time every day. Avoid blue light from electronics such as TVs, computers, and smartphones just before bedtime. Instead, opt for soft music, light reading, or other relaxing activities. Try using glasses that block these lights in the evening. Check out my video on biohacked True Dark glasses. They can really make a difference. Also, there are programs that you can put on your computer that slowly reduce blue light in the evening. One of them is f.lux. I also just got a new cell phone that has night mode built into the operating system, which removes blue light. If your cell phone doesn't have it, I'm sure you can find an app that will do the same thing. If you're stressed, seek help from your loved ones or from a professional. Ignoring it can lead to worried thoughts through the night. Avoid alcohol, caffeine, and heavy meals at dinner. Make sure you eat some healthy proteins and fats 2 to 3 hours before bedtime. Even though alcohol is a relaxant, it can disturb the normal sleep cycle and make it difficult to stay asleep. Create a relaxing sleeping environment and bedtime routine to help your body unwind. Try sipping on a cup of herbal tea or soaking in a hot bath. Get some physical exercise during the day, preferably in the morning. This actually helps you sleep better at night. Supplements like glycine, ashwagandha, phosphatidylserine, L-theanine, magnesium, tryptophan, kava, chamomile, hops, and valerian can make a difference. When your blood sugar dips too low, it can cause an increase in adrenal stimulation, which then can cause an increase in blood sugar. While I mentioned that eating a heavy meal before bed, not having enough food is also an issue. Eat some healthy proteins or fats 2 hours before going to sleep. You can also try eating some almonds if you wake up in the middle of the night to see if it helps you get back to sleep. They can stabilize your blood sugar. Excessive napping in the day. Stress increases your cortisol levels, which can alter your circadian rhythm. Remember, melatonin, the sleep hormone, opposes cortisol. When cortisol goes up, melatonin goes down. Try meditation or yoga before bed. It can really make a difference in clearing your head. A type of psychotherapy that can help you take charge of your thoughts and emotions is called cognitive behavioral therapy. This includes stimulus control therapy, sleep restriction, biofeedback, and relaxation techniques. This can be very powerful. Medications are only recommended for short-term use and are never the first line of treatment. This is because they're associated with several side effects, and their effects on sleep only last for a short time. In addition, it's common to not feel as rested because many people can't get into the most important phases of the sleep cycle. These medications include benzodiazepines, non-diazepine sedatives, and antihistamines. Alternative therapies do provide relief to many. A Harvard study demonstrated the positive effects of meditation on sleep. Meditation can be something as simple as focusing on your breathing or even listening to meditation audios. You can even try progressive relaxation, which involves relaxing your tensed muscles one by one. This helps relieve the emotional stress along with the physical tension. Guided imagery is a technique involving both mind and body to promote sleep. It can be a daily ritual before turning in for the night. The famous technique of counting sheep is an example of guided imagery. There are several manuals that you can take through this technique, and you can research which ones might work for you. Several studies report the benefits of aromatherapy, using essential oils such as lavender and sandalwood for relaxation and sleep. You can easily add a few drops of these essential oils to a cotton ball and keep them next to your bed. You can also use a diffuser, candle, or use bath oils for soaking in. Melatonin is a hormone that regulates our sleep-wake cycle, also known as the circadian rhythm. Its production is influenced by light. It's available as supplements and can be used to treat sleep disorders, but I rarely use it as a first-line treatment. Here again, it's not treating the cause, but yet the symptom. Only by admitting that there's a problem and taking control of the situation will you be able to cure your sleeplessness. A restful, sound sleep is something you deserve, and you can take the first step in that direction by following the simple lifestyle changes and remedies mentioned here. Thanks for tuning in. I hope you've learned some things about your health. If you'd like to know more, please go to my website, drcelaya.com, where you can schedule for a free 15-minute consultation or become a new patient. We'll look into your issues with lab work to get to the root cause of your problems. If you'd like to see more videos about your health, please subscribe below.